right there. Welcome back to Talk 1260 KTRC. You're listening to the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm a plastic surgeon. Here with my wife Betsy.
I'm still hanging around.
Yeah, we had a great first segment with Chris Reed.
I love Chris. She makes me hungry.
Yeah.
Oh my God.
She's talking about essential oils and cooking. Oh my God, my stomach is
she's
rumbling.
good. She's good.
So we talked a lot on this show about how there seems to be a trend towards a more natural look in plastic surgery, and the pendulum seems to be swinging back to more natural stuff. At least that's what I saw in my practice, and we've been vindicated. There's a national publication that just wrote
Women's Wear Daily's
nice,
Beauty Buzz. They come out, how often? Every month or quarterly?
This one's kind of, I think quarterly.
Quarterly. Anyway, we get them here in Santa Fe. You can probably find it at... what are they called? You know, all those little newspaper places. I have no idea what the names are.
This is a good, it's a great article.
It's a great article called Hollywood's New Natural. And it's all about the fact that, you know, the ladies are getting Botox, but they're getting it so they can still move their face.
Right.
So when they're crying, you can see it.
Right. And they quoted me here saying, you know, that my average implant size seems to be going down from about 400 to 300. Right. And we talked about, what I like about the article is they talk about how people are still getting plastic surgery.
Of course.
They're just trying not to look so overdone. And from a plastic surgeon's perspective, that's really hard to do. It's very hard to make somebody look natural.
But can I tell you something? What I've noticed? Plastic surgeons have their styles, especially back in the 80s and the 90s. It was like, if you want a nose that looks like this, you go to Dr. Smith. That's no one. Right, okay, whatever. I don't want to name names in any way. But
Florida, he's retired. The Goldman tip was the nose of the 70s.
Oh, okay, fine. Right, okay, so that pinch turned up tip.
Right.
There was a ski slope nose that was big in New York. Okay, fine. So whatever, anyway, you know, they've got the boobs by a certain, you know, there are certain plastic surgeons that have set the trends.
Right.
But not all plastic surgeons can do that, and they don't really want to. It's not in their heart. You're not one of those fakey types that's going to blow out somebody's mouth, blow up their boobs, and snip off their nose. That's not your way. And you know, you were trained in New York, and a lot of New York plastic surgeons, very, very subtle, because that's what the New York patient wants.
Yeah, they don't want to know that they want to look refreshed, not like they've had a face done.
Right. New York is funny. It's ostentatious, but not in certain ways. It's very funny. We kind of low key. So there's certain styles, right, for plastic surgeons. You happen to be a surgeon who enjoys the natural enhancements.
It's challenging. It's challenging. It's very easy to throw a huge implant up, you know, into somebody's chest. Like, for example, the tuba, the transumbilical one through the belly button. You just throw in a big implant way up there. And
how can you place it?
It's very difficult to place. I'm sure there's a few masters who know how to do it just right, but most people who do the tuba, just, you know, you end up with enormous breasts that, you know, may or may not be even. It's much more difficult to really define the crease and to get it right, etc., etc. Right. Anyway, so
yeah, you were quoted multiple times, and this article, I mean, if you want to know what the major plastic surgeons in this nation are thinking, read this article, Hollywood's New Natural, in the new issue of WWD Beauty Buzz. You've got Cheryl, coming out next month. You've got Cheryl Aston in here.
He said something really cool. He said that people are also moving away from all these fillers that they put in their face, because they're finding that they're spending so much money on fillers. After 5 years, they could have just had a facelift.
Yeah, but there's some people who want to, like I want to have cheekbones. So
that's his perspective, and I'm finding something different actually. I'm finding with the Artefill now that lasts so long, and you don't need so many touch-ups. Cheryl Aston doesn't use Artefill, but now with the longer lasting ones, there are a lot of people using that filler because it lasts for such a long time.
Yeah, it's amazing.
That was an interesting call. Who else is in there?
Yeah, you've got Calabria in here. You have Canodia, who
he's
did
the nose guy.
Right, he did
very subtle nose.
Ashley Simpson's nose. Garth Fisher, who's very famous, and then some other guys that I've never heard of, but I'm sure they're famous. You've got that Dorfman, Bill Dorfman, the cosmetic dentist in LA. He was on those extreme makeover shows.
And they're all talking about how people are going to the same thing, a more natural look. Whether it be, there's a dermatologist in there, whether it be skin or teeth or breast or face. I like this trend. It's a more healthy one.
Yeah, like here, Jessica Wu, the dermatologist you mentioned, she says she now uses Botox to soften expression lines instead of totally wiping them out.
Right.
and which is what we all did. We all OD'd on the Botox. I personally still don't want any movement in my face, so I don't care what the trend is.
You're in Frederick Brandt's camp.
Fine, I don't care. I don't follow trends, never have. I got my own thing I got going here. But yeah, there are people who want to stop, you know, the major wrinkles, and so they stop the majority of the movement, but on the surface, they're still able to have some expression.
Yeah.
Yeah, no, of course. Richard Fleming, he's very famous. Who else? Anyway, there's a lot. These are all people who operate, a lot of them, on very famous people that we all watch on TV and on the big screen.
Right.
So really, if you want to know what everybody thinks, get this article.
It'll be on my website, danielronelmd.com, as soon as I get it up there.
Right.
It might be there already.
Yeah.
So
anyway, it's good. It's interesting. I mean, what are you finding? Like, you know, people are so into these butt augmentations now, making their butts larger.
Yeah.
How does this natural trend affect that?
that is
Or is that
really
an anomaly?
that's an anomaly.
Okay.
Anybody who wants to really augment their butt is already getting away from the natural look.
Right.
And at least here, where we are in New Mexico, there's the Hispanic influence, which really wants an overly large butt. And so,
That's everywhere. I mean, that's everywhere. New York
Yeah.
is full of Hispanic culture.
again, the
you know.
implants I put in are moderately sized, and a lot of the patients, you know that, and they go somewhere else to get a really super large butt, which I don't want to do. I just don't think it's safe. But
That's not safe.
anyway,
eat more, lady. You want a big
Yeah.
butt? I got some candy. I'm happy to give you.
right.
Eat. But I see a lot of white girls that are very skinny and have nice little trim bodies with a saggy butt. They need an implant right on the top half of their butt.
Yeah.
Because they got
True.
no behind. It's
Right.
not attractive.
Either an implant or a lift or both.
Yeah.
The thing is, the lift gives you a big scar, so people shy away from that. The implant is a much smaller scar.
You know, to me, these ladies look like, I'm thinking of just a couple, they look like they could really use a little implant right on the top.
Yeah.
Anyway, yeah, no, a nice butt is nice. And listen, for those of you like me who still like, you know, the semi-artificial look, you know, on whatever your body part of choice is, or all of them, don't feel bad. That's fine.
Yeah, and
This
I
is
do
a
that
trend.
too. I saw
You
a
don't
lady.
have to follow the
I saw a
trend.
lady today who wants a 700cc implant.
Oh my gosh.
Very large, but it'll fit her. She's about 5'8", 155 pounds, broad shoulders.
That's still massive.
And when you go through the armpit, you don't really have the same safety issues with a large implant as when the incision's right on the breast. Because when you have the incision, the traditional one, right under the breast, the implant's going to push against it and it can break through. Through the armpit, it's safer. You have a lot more leeway, so it'll look good for her.
That's huge. Wow. Okay, well,
All right.
good luck to
We've
you.
got to wrap things up. Thanks for listening. Talk 1260 KTRC if you want more information.
Yes, we're not going to be taping
Oh.
next week, so happy
Yeah.
Thanksgiving.
Happy Thanksgiving. And there's a great promotion going on. Forgot. Artefill. This is about 30 to 40% off.
Whoa!
From now to December 7th, the company has given it to me at a reduced price, so I can pass it on to you. The
I've
more
seen
you
that on your
purchase,
Facebook page,
yeah,
right?
the more you purchase, the more you save.
You don't have to get it done now, you just buy it
Right,
now
you just
and
have to
reserve
purchase it before
Right.
December 7th. That's what Suniva has told me,
So
the
if you-
company. So
yeah.
people are really buying a lot and sort of putting it in the bank.
I
which
would,
is
I'd stock up,
great.
but my
Yeah.
cheeks are full.
Okay.
Have
Thanks
a
for
happy
listening.
Thanksgiving, enjoy your start of the holiday season.
Bye.